everyone, I'm Mangino. Welcome to the Mangino Talks Pittsburgh podcast. We talk about everything that matters to us all, from current events to Pittsburgh history, social issues to sports, politics, to practical day-to-day life. And something that's really fascinating to me is the issue of marijuana use. And right now in Pennsylvania, obviously, we have medicinal marijuana. There's growing talk about the possibilities of enabling recreational marijuana use. And there's an interesting story that I came across today about the number of senior citizens that have tried marijuana. Not only at one point in their life, back in their teen years, as baby boomers they are, but even recently as well. According to this, more than a third of people 65 or older report having tried marijuana. A portion that's actually tripled since 2009. Men, absolutely off the charts, tenfold increase. Women that were virtually zeros when it comes to marijuana use now, greater numbers of them as well using marijuana, both for medicinal reasons and for recreational reasons. And when it comes to talking about this issue, there's nobody better to go to than Patrick Nightingale. He is the executive director of the Pittsburgh chapter of NORML, the National Organization for the Reform of Marijuana Laws. And Patrick, your reaction to these survey numbers?
Honestly, it makes sense to me because as we have legalization, we have regulation, and we have the ability to access both adult use products, or what you might refer to as recreational products, and medical marijuana products in a safe, tested, regulated setting. Interestingly, I was discussing this issue with my wife, Teresa Nightingale, who is with Cresco Labs, one of Pennsylvania's medical marijuana companies. And she said that the feedback she gets from their wellness advisors at their dispensaries is that seniors love the fact that it is regulated, that they can talk to a wellness advisor or talk to a pharmacist about what is appropriate for them. And these are people who never would have considered going into the legacy market or the illicit market to acquire marijuana products to treat their chronic pain or other conditions. As she said it, older people simply don't have a connect. They don't have a guide to go for. And now that they have a regulated and safe means of acquiring cannabis, whether it's adult use or here in Pennsylvania medical, it makes sense that this is probably the most rapid growing demographic amongst new marijuana consumers in both adult use and medical marketplaces.
It seems to me, from what I've been able to gather, that the aspect that many of these baby boomers, upwards of 30% of them, were at one point using in their life in the 70s into the early 80s, like late 60s, 70s into the early 80s. I'm wondering what you think about that, laying the foundation to the openness of using this now when it is, clearly regulated, safe, pure strains without concerns of any contamination from any other drug that may be out there as well.
Well, I'm not quite a senior. I'm only 53. But what I can tell you is that especially in the 80s, there was such a backlash against marijuana use. It was lumped into, hard drug use, that I would submit that anyone in the 70s who may have played around a little bit, tested, some here and there, simply said, listen, it is not worth it. If I'm going to be treated the same as a hardcore drug addict, if I'm going to lose my job, if I'm going to be publicly humiliated, there's absolutely no reason for me to continue to experiment with this drug. Fast forward 40, 50 years, here we are with widespread acceptance of cannabis, both for adult use and for medical use, and not just widespread acceptance of cannabis use, but the ability to obtain cannabis in a safe, regulated, retail environment, and knowing that the products are, as you referred to earlier, tested and safe. Because I can remember as a young consumer, you had no idea what you were getting. You were lucky to get it at all, and you had no idea whether it was contaminated with mold, how it was grown, whether what you were purchasing was what it purported to be. And it's something that, for example, is very important to my wife as a cancer survivor, because she knows that the products that she is using to treat her cancer in remission are safe, tested, reliable, accurate, and consistent. And I think that that is something that, is very appealing to a demographic that probably, has other medical issues that they're concerned about. A demographic that, wants to know that their cannabis use is not going to have any interactions with the other prescription medications that they're taking, and a demographic that, is comfortable having this discussion with their treating physician. I'm a medical patient, and I just love to be able to see my UPMC chart that lists, my prescription medications and also lists medical cannabis, so that I can have an open conversation with my primary care physician or a specialist that I'm treating with, as opposed to feeling, oh my God, I better not reveal this because it's illegal.
Right.
Who knows, how that might, affect, my primary care physician's willingness to prescribe certain types of drugs to, address, acute issues of pain, et cetera.
A recent survey saying that when it comes to seniors, there's a market for them, obviously, with sleep problems, pain, anxiety, a number of other issues as well. And older people are willing to explore the possibilities of what cannabis can provide for them in relief. Interesting, legalization of recreational marijuana in states show that there's a benefit. I was kind of surprised at this, in a decline in workers' compensation payments among older workers, even those aged 40 to 62. The argument being that this availability for medicinal marijuana for pain, in contradistinction to non-pharmaceutical pain management, or pharmaceutical pain management, actually has contributed to better conditions, better outcomes, and better worker performance, interestingly enough.
I am grateful that I do not suffer from chronic pain. And, for every chronic pain patient that I've talked to, the issue has always been, I am tired of being on opioids. They don't work the way they used to. I need to have increasing dosages for it. And I have a number of side effects associated with long-term opioid use, especially, for older people with issues of, constipation and being unable to move their bowels because of long-time opiate prescription. And to have this treatment alternative just, seems to be something that pain patients across the board are very happy to have the alternative to at least attempt to use. I think one of the biggest impediments we see from really substituting opioid or substituting medical cannabis for opioids is simply the cost. Here in Pennsylvania, a workers' compensation carrier has been ordered to cover or reimburse the cost for medical cannabis. So, that's some good progress. But outside of the workers' compensation realm, a medical insurance provider, is not required to compensate or reimburse a patient for the cost of medical cannabis. So for patients who are on a fixed income, adding $200, $300 per month in medical cannabis is, unfortunately, for a lot of people, out of reach.
We are talking once again with Patrick Nightingale, and he is the executive director of the Pittsburgh chapter of NORML, the National Organization for the Reform of Marijuana Laws. There are some concerns that some people have expressed regarding the use of marijuana. Some people look at this as an absolute panacea, that it's all good, that there is no downside to have to be concerned about. But I want to get your reaction to a couple of things. The issue of confusion and what some are labeling as cannabis use disorder. Your thoughts about that?
Cannabis is a psychoactive substance. It gets you high. It produces a psychoactive response, and that might not be for everybody. And certainly, as with anything from eating cheeseburgers to going to the casino to compulsive shopping, for some people it may cross the line into abuse. Fortunately, unlike so many other substances, cannabis is not physically addictive. However, for some people, it may prove to be, something that they have difficulty, getting their hands on. So I would agree with the notion that it's irresponsible for cannabis advocates to say, this is the perfect plant. There's absolutely nothing wrong with it. Absolutely no harm can come from it, because I think that's, somewhat disingenuous. However, the harm that does come from it, I think, is substantially less than comparable substances or avenues of abuse. And again, like I said, it is not physically addictive. There has never been a single fatality in the entire history of the human race attributed to cannabis intoxication or acute cannabinoid toxicity. But again, if someone is having difficulty, doing their day-to-day job, if they're having difficulty getting up and going to work, if they're having difficulty adequately caring for their children, and cannabis plays a role in that, then that's something that person may need some help moving past. It is not as you said, simply a panacea, though it is a very, very effective treatment option that, compared to other pharmaceutical drugs and other substances such as alcohol, has a much, much more benign downside to it. But we can't ignore the fact that, yes, there is a downside.
What would you say would be the reasons why there are those that feel the need to go to the emergency room? Emergency visits are attributed to marijuana consumption. In your understanding, what is the connection?
In my opinion, the connection is it's multifaceted, but primarily I would say it's people who are consuming edible products who simply consume too much. Because an edible product can produce a very intensive psychoactive effect from a very small amount of product. I remember hearing local radio celebrities joking about getting a gummy bear when they were in Colorado and being told, just eat one leg off of the gummy bear. Whatever you do, don't eat two legs and don't eat the whole gummy bear. Well, if you're a new cannabis consumer and someone hands you an infused cookie or chocolate bar or Rice Krispie treat, and they say, you know what, you better just nibble a little corner of this and wait 45 minutes to an hour to see what the effect is. Unfortunately, I think that people who are new to cannabis are going to be like, "What? Are you kidding me? How much? What kind of wallop can a cookie possibly pack with it?" And the answer is, it can pack such a wallop that you may feel that you need to go to the emergency room. When in fact, what's happening is just a very strong, intense high, which will pass. It does not risk any long-term medical effect, but for the person who's going through it, it can be very, very, very unpleasant and uncomfortable. Now, add to that the unregulated Delta-8 products and other hemp-derived psychoactive products that we see proliferating, not just like head shops or glass stores, but available in gas stations and other places. These products are not medical marijuana products. They're not tested adult use products. They're products that are extracted from legal hemp, which is legal under the Farm Bill. Mm-hmm. And through a process of chemical extraction, producers are able to produce psychoactive products such as Delta-8 THC. Delta-9 THC is, of course, the famous THC that's in marijuana that gets you high. Well, Delta-8 does that as well. But, these Delta-8 products we're finding are getting into our high schools, are getting into our middle schools. And I think that you're seeing an increase in emergency room admissions or reports to the emergency room, because these unregulated products are also working their way, not only just into the marketplace, but they're working their way into our schools. And a 12-year-old is 1,000% ill-equipped and should never have access to any type of psychoactive product, whether it's cannabis or anything else. But because these Delta-8 products are unregulated, being legally sold, and like I said, in gas stations, it's very easy to see how these products start working their way into schools and how children are getting their hands on them, whereas at least in a legal, regulated environment, you have someone checking ID at the point of sale and not just selling unregulated and untested products to whoever walks through the door.
Patrick, what advice would you give to those that are seniors and others that are looking at it, as it is in Pennsylvania, medicinal marijuana and some of the marketing that goes into these products, not only the well-regulated medicinal marijuana, but the others that you just talked about, many of them promoting how this is great for sleep problems, for pain, for anxiety. To what extent do you advise individuals doing some of their own valid research to ensure that this is really the right product for them, and who should they be consulting in all of this?
Well, here in Pennsylvania, we have a requirement that our dispensaries have either a physician or a pharmacist available to patients whenever the dispensary's doors are open. So my advice would be, if you decide that you want to become a registered medical marijuana patient, work closely with the pharmacist at the dispensary that you choose, because that individual can help guide you to products that may not be as strong, products that can help you gradually get introduced into cannabis. For seniors who are not medical patients, I would caution buying anything that is unregulated and untested, such as Delta-8 products, as we already discussed. Mm-hmm. And that would leave that senior either relying on a legacy market or illicit market cannabis dealer, or risking going to a legal state such as Michigan or New York, making a purchase there, and then risking transporting it back to Pennsylvania. I don't want to make a presumption about it, but chances are pretty good that seniors who find themselves interested in cannabis for the first time may very well have a qualifying condition, so that they would have the ability to access legal medical marijuana in Pennsylvania and take advantage of having a pharmacist to speak with to try to dial it in, so they're not making a mistake and buying a product that could be far more potent than what they need or what they can tolerate.
When we're talking about the Delta-8 products that you were referencing earlier, even CBD to some extent as well, should parents, grandparents, aunts, and uncles be very cautious about what their young people are going to the store and able to gain access to, just basically over the counter, walking in and being able to purchase?
I think that that parents and grandparents and caregivers of children need to be aware that these products are readily available. I would hope in most cases that at least the store selling them requires an ID from someone who's 18 or older, but the ready availability of these products, their packaging to make them look like candies and to make them attractive to young people, is something they really do need to be aware of. And it is something that concerns me as an advocate, because I don't want to hear someone who is in opposition to reform saying, wait a minute, my 12-year-old just went to the emergency room because someone brought a Delta-8 lollipop and gave it to my daughter at school, and they got really high and really sick from it, and you're telling me you want to legalize this all of a sudden? My concern is that it has a potential for a real backlash against our legalization efforts, even while it is providing small business opportunities for hemp entrepreneurs across the country. I think the answer ultimately lies with either some clarification from the DEA about whether or not these products are in fact legal under the Farm Bill, and if they are legal under the Farm Bill, some type of state level regulation requiring, accurate testing, labeling, so that people know exactly what they're getting instead of, who knows, what's in that lollipop, because there is no regulation.
Yeah, it's a fantastic point to bring up because we're dealing with this. You may have seen the news recently about people who are marketing energy drinks, and it's just caffeine levels that are off the charts, and they're being marketed to kids. And I'm sure that there are many others that are looking at other products like what we're discussing in part that are trying to figure out ways of being able to tap into that financial market too. Interestingly enough, the National Survey on Drug Use and Health, it's been a 5-decade effort on the issue of substances by the Substance Abuse and Mental Health Services Administration. Speaking with 70,000 Americans over time, shows that 49.1% of Americans have tried marijuana. And then you look at an increasing number of senior citizens that are open to this, a 5-fold increase, quintupling over just the past decade or so of those that are willing to give it a shot. It seems as though this is the road that we are on. And the best thing to happen out of Harrisburg is not to insist on keeping it illegal for recreational purposes, but really do what's right by putting the regulations in place to ensure that everybody is able to use as safely as they possibly can be. I kind of liken it back to during Prohibition. Who knew what was in that bottle of alcohol? You didn't know. But once you're regulated it, legalize it again, now we do know, and there are safeguards that are in place so that people have the ability to drink responsibly, where now there is no real assurance about being able to consume responsibly if the regulations aren't there. Your thoughts regarding that?
I agree with that 100%. Since we've had medical cannabis in Pennsylvania, it is something that I, as a patient and a cannabis consumer, am very, very heartened by, to know that what I'm consuming has been tested, it's pesticide-free, it's mold-free, and I know exactly what I'm getting. And especially for an aging population, like I said earlier, an aging population that may have other prescription medications that they're taking for, run-of-the-mill issues, hypertension, blood pressure control, maybe taking medication for chronic pain or for whatever, and to know, that the product that they are getting is safe and is not something that's going to have some unforeseeable side effect associated with, perhaps being a moldy product or, not purged, adequately, or, other issues that surround, the illicit production of not just the marijuana plant products, but marijuana products such as edibles and tinctures and hash oil concentrates, so on and so forth. So I think that, a very compelling argument for legalization and regulation is, we have maybe up to 2 million plus people in the Commonwealth of Pennsylvania who are some type of regular cannabis consumer. They should have access to safe, tested products as opposed to being treated as criminals and forced or compelled to use untested products in the illicit marketplace.
Patrick Nightingale, once again, he is the executive director of the Pittsburgh chapter of NORML, the National Organization for the Reform of Marijuana Laws. You can also find him at PAN Law as well. Patrick, thank you very much for your time. Do appreciate it.
Robert, it is always a pleasure, and you have a great day.
Thank you. You as well. Make sure you keep on listening for Mangino Talks. Thank you for listening to the show today. And please be sure to click the subscribe button so you don't miss an episode. For more on me and the show, make sure you visit ManginoTalks.com. If there is a topic that you would like me to talk about or a guest that you would like me to have on, send me an email at Mangino@ManginoTalks.com. Follow me on your favorite social media platform by using @ManginoTalks. And then once you find me, please like, follow, subscribe, and share the pages with your friends and your family. Thanks again for listening to the Mangino Talks podcast.
You can take a picture.